Welcome back to Love Your Tribe Tuesday, where we connect you to our favorite and most valuable members of our tribe. I'm Deanna Brees, and I'm a licensed mental health counselor. I am also a parenting coordinator and trained in as a Florida Supreme Court family mediator. And I specialize in seeing individuals, couples, and families.
And I'm Mona McGregor. I'm a licensed mental health counselor, certified clinical sex therapist, and hypnotherapist. I specialize in couples, individuals, and adolescents.
And Mona and I are the co-owners of Ideal Life Counseling and the co-founders of our unique social group, Urban Tribe. This month is Mental Health Awareness Month. So we thought we would close out the month by talking about and trying to overcome the stigma of mental health.
Mental health is essential to everyone's overall health and well-being, and mental illnesses are common and treatable. 1 in 5 people will experience at some time in their life some time of mental illness. Everyone is going to face challenges in life that can impact their mental health. So we're so excited today because we have Dr. Mariana Delgado with us, and she is going to answer some questions for us about National Mental Health Awareness Month. One of the first things I wanted to ask you, Mariana, was, based on the fact that every one of us will have faced some kind of challenge in their life to do with their mental health. But some people think that seeking treatment is sort of something you do if you're weak, and it's challenging for people to sometimes seek that help. They'll turn to a friend before they'll go to somebody that's trained. Can you describe some of the typical patients that you see in your office?
Some of the typical, well, first of all, I just want to say thank you for inviting me. This is such an important topic and so helpful to so many, because you're right, a lot of us do go through challenges in life. So I'm a holistic psychiatrist here in Safety Harbor, and the typical patient I see is a high-functioning, motivated person who maybe stumbles upon a trigger or a stressor that causes them to fall into a depression or anxiety. And so, I think what I want to do, though, and go into more detail about that, is to just back up a little. When you first told me about this question of mental health, I was talking to you about how the first thing I think about is, when it comes to our overall health in general, I think healthy lifestyle habits, choices. And so the same way we feed our body nutritious food for it to function optimally, we have to think about that's going to our brain as well. So is this going to be helpful or harmful? And it all comes down to choices. The things we feed our mind, we want to think about, is this a nutritious thought? Is it positive? Is it uplifting? Or is it negative and going to cause us to feel down? So when we have healthy lifestyle habits, sometimes that's enough to keep us every day. We're exercising, we're resting, we're hydrating, we're keeping our minds in a positive place. But it's when life throws a trigger, a stressor, that sometimes we find ourselves stuck in a negative pattern. And sometimes talking to a friend or a family member is not enough. The motivated patient who comes to me and has observed a pattern of behavior, maybe they go through episodes of depression on and off, and they really want to explore, where's this coming from? They want to look at how they've coped in the past, and realizing it's not serving them in their present, they want to develop new perception. That's where getting into therapy to really have self-awareness of these patterns and work on breaking them, creating new, more healthy patterns of thought. In my practice, I see patients sometimes just for therapy, sometimes medications are needed. And there is that stigma about being on a medication. And the analogy I give my patients is, it's like putting a cast to set a bone. We need to strengthen the bone, and that's where we're strengthening our minds with positive thoughts and really challenging the old coping mechanisms that maybe served us well in childhood that we don't realize we're still using in our adult life. And as that bone is setting, or as these thoughts are becoming stronger, the more positive, nourishing thoughts are becoming stronger, that cast is providing that structure and that place to develop, to get stronger. And for most people, you can eventually, the cast comes off, and you've established these healthy lifestyle patterns and ways of thinking that will help you maintain the gains that you get in therapy. And so, did that answer your question?
Yeah,
That was great, because I think one of the things that Mona and I love about you, and why we refer many of our clients to you, is that you do have a holistic approach. So we know that you're going to do a thorough evaluation and decide whether or not medication is even indicated for those clients. And I think you did a good job of answering the question, or one of our questions, which was, how do you combat the stigma of going on medication for people? And I loved your analogy of the cast. One of the things that I tell my clients when they're reluctant to go on medication, if that's indicated, is if you had a physical illness like diabetes, and your doctor or your physician told you that you needed to take insulin, you wouldn't think twice about that. You would just do it. So when medication is indicated, to think of it in that way, that it's not a sign of weakness, it's just the way your body is functioning at that time.
And
Yeah,
it's very
and a lot of, oh, go
I
ahead.
was just going to say that when you talked about the cast idea, because if you're not feeling well, you're not likely to strive to pick up new habits, to eat healthy, to exercise, to do your affirmations. You're not likely to have that urge or that drive. But if you're feeling a bit better, you can then implement some of those things that are going to help with feeling good. Let's face it, the goal is to feel good.
Right. And just this morning, I was talking to a patient. There are patients who come to me at different levels of intensity of their symptoms, right? And so when your symptoms are so strong that they're affecting your sleep, your appetite, you've got those butterflies in your stomach, the mind won't shut down. There's no way you're going to take in anything in therapy. It's like we got to calm the body. Like I was telling my patient this morning, sometimes what happens is we have our fight or flight response. And with anxiety and panic disorders, it's going off, and there's no lion attacking you. There's no, danger, but your mind creates danger, and your body responds just to the thoughts. And so it's the adrenaline rush. And then you really, like, you're right, you can't sit down and meditate. You can't, have a nutritious salad, and all you're focused on is your physical symptoms. So that's where I see medications play a role. We want to calm the body, so then the mind can calm down and take in what it needs to learn. Yeah.
Oh, that's tremendous. Thank you. So I'm curious, how do you think that friends and loved ones can be supportive if they know someone or they love someone that might be struggling? What advice would you give to someone who has someone in their life that is in a challenging spot?
I think that first and foremost, if you love this person that's going through this struggle, it's just to be there and to listen. A lot of times friends and family are well-meaning with their advice, and sometimes though they can be not as supportive when it comes to medications. Let's say they have their own take on, oh, those are addictive, or you're going to be a zombie, and that just makes a already depressed and anxious person more overwhelmed. I think that family and friends should support whatever modality their loved one is using. There is a place for family and friends to have concern if they maybe suspect that the person is over medicated. But, I think it's helpful to just allow to support whatever it is they're doing, and to ask, what else do you need? How else can I be helpful? Sometimes people have their own idea of what's helpful, and we're all different. And what's helpful to one person may be really stressful to another. So it's helpful to listen and ask what that person needs, and encourage and support whatever they are doing, whatever steps they are taking.
Excellent. And would you agree that, talk therapy along with, if they were to need medication, is a good pair?
Absolutely, absolutely. I think, there's all kinds of people, and there are some people who I see who are not able to go deep into where issues come from. And some people have this comfort with the medication, and they just need to vent. And there's a place for that too, and that's helpful. But I think the greatest change and positive effects come when we can examine ourselves and really realize, where does this negative thinking come from, and how could I turn this around to support myself, and be able to fulfill your highest purpose. For me, therapy is all about learning to deeply love and accept ourselves, moment to moment, and shut down that inner critic that we all can have. Sometimes in times of stress, the critic is louder, but we can learn to. This is going to sound counterintuitive, but we can learn to love that part of ourselves too, that inner critic. Give that a place in our being, but not let her or him, be in the driver's seat.
Right.
Because we're multifaceted people. So we have our confidence, we have our insecurities, we have our all kinds of facets, and we have to love all of them.
So just
But
kind of embracing the good, the bad, and the ugly in ourselves.
exactly, just like when our gut biome bacteria overgrow, they produce not so good things in our body. Same thing with the inner critic. We don't want the inner critic running the show. We have to recognize that there's certain things that we had to do to sometimes survive childhood, but those mechanisms, those coping styles, are often not serving us in our present, and we don't realize that we're being driven by those still. And therapy is a place to look at that and have a safe place to examine these things.
So you've given us some great tips. You've kind of thrown some things out there about taking care of ourselves. But can you maybe summarize what are some healthy ways that we can take care of our mental health? And then I know you do a lot of things to take care of your mental health. Maybe share some of those things that you personally do so that you can stay mentally well.
Yeah. Okay. So I have experienced depression and anxiety. I've been in therapy. I've examined some of the inner child issues that I was still carrying around. I was able to, and this doesn't happen overnight. It's a journey. We're all a work in progress. So for me, I've added positive layers, over the years to the things I do to stay in a positive place. Most importantly, learning to be my own cheerleader and being positive no matter what, whether I'm having a down day, productive, unproductive. I always think I'm doing the best I can in this moment, and that's okay. Give myself breaks when I need to. Listen to my intuition about if something doesn't feel right. I'm proud to say today I can speak up and set a boundary, or tell a person respectfully, I don't like what you said there, or whatever. So positive, being your own cheerleader, starting actually, setting intentions. Like in the evenings, I may set positive intentions for the next day. It's almost like a rehearsal for your next day. What do you want to see happen? And so it's all in the mind. Everything we create, everything we experience starts out with a thought. So let's have good thoughts. And then, of course, always being in gratitude and focusing on what I have instead of what's lacking. And taking care of my physical body with good nutrition, hydration, getting enough rest, um, and nurturing a spiritual practice, whatever that means for anyone. For me, it's just reflecting on, being grateful, and uh, it's important to really examine our relationships. Some of them might be draining, some of them might be uplifting. So we really kind of do have to do like a gardener, weed out, and keep the draining people in the outer circle and have your more positive people in your inner circle. Um, and just again maintaining the physical body with exercise. I weight train, I do yoga, bike ride, take walks. Um, what else?
You're a dancer. You love to
Oh
dance.
my gosh, I love to dance. Look at me. I'm just I it brings me such joy. And you know what? I've been thinking about this. For me, dance is like a metaphor for life. Okay, for many years in my relationship, I stopped dancing for about 17 years. I can't believe it, but I did. Okay. When I came back to dance, um, it's such an empowering thing for me, and everybody has their thing. It's important to examine what is your passion, and really pour yourself into that. For me, it's a metaphor for life because it's a place where I feel free, I feel peace, I feel joy. I'm creative. It's an adventure. It's energizing, and it really feeds my soul, and that fuels my days. Just looking forward to the next time I'm going to dance. So that's really important to examine our passions and feed that and make sure we're making time for that. And then of course vitamins and things like that, and cleanses I do to keep my body as clean as possible. And just choices. It's all about choices and really being mindful of what we're doing, eating, and thinking. Let it all be good and positive.
I think it's so important for us as mental health practitioners that we're all practicing what we preach. So we need to set good examples for our clients by doing those things, all of those things that you said, and then finding our own passion and making sure that we're following through with that.
Exactly.
Yeah.
It was so interesting because you were listing all these things and I couldn't wait to hear you talk about dancing, and you just lit up. So, having something in your life that lights you up like that. Something else, Mariana, that you and I have talked about before, I'm getting ready to, this weekend, I'm wrapping up yoga teacher training. Woo. And, but something that we have talked about is that you enjoy yoga, and there are many times that you leave a session, you tell your client to bring their mat, and you head off to the yoga studio together. I love that. I love that you set the example. I love that you help them feel comfortable trying something new. And that's another incredible way to be mindful and to be grounded and to connect with that. That's another thing I've always been so impressed to hear that you suggest that. And I do that with my clients as well. It's really important. It has been so wonderful to have you here. You've been a dear friend of ours for a long time. We've worked together before, and you come to all of our events, and you're an amazing advocate for mental health in our community. I just appreciate everything that you do. And you're one of our favorite urban tribers. So wonderful, because you always contribute and you show up. And again, you're an amazing example in our community. So thank you so much for being with us today.
Oh, you're welcome. What a pleasure. Thank you for inviting me, really.
Thank you, Marianne. It's always good to catch up with you.
Right.
So we hope that you enjoyed our interview with Dr. Delgado, again, a psychiatrist, and her office is located in Safety Harbor. We hope that you join us on June 9th when we talk to Joey, and I'm going to mess up his last name, Bumbaco, to discuss his participation in a project called Keep Pinellas Beautiful. And he's adopted an island in Dunedin to clean up. So we hope that you will tune in on June 9th. We love catching up with you all, and we will see you soon.
All right. Bye-bye.